In recent years, in the Philippines, the issue of poor appetite, malnutrition, and the leading causes of malnutrition-related diseases and immune deficiency in children have been a concern. According to statistics from the National Nutrition Institute, about 21% of children from 0 to 6 years old are in a state of malnutrition, while 41% of children from 6 to 18 years old are stunted in height and weight. Poor appetite and slow weight gain in children can be caused by many factors, including medical condition, psychological issues, and the inability to absorb nutrition. Welcome back to Health Talk. Today we will discuss a topic that many families are concerned about, the issue of anorexia and slow weight gain in children. Joining us is Dr. Linda C. Stock, President of the Nutrition Association, working at the National Nutrition Institute, who has a new practical solution for children that she wants to share with our audience. Doctor, could you please explain more about the issue of anorexia and slow weight gain in children?
Thank you for inviting me. This is an increasingly prevalent issue in the Philippines and many countries around the world. Loss of appetite and slow weight gain can be caused by various factors, including medical conditions, psychological issues, and poor nutrition. When children do not receive sufficient nutrition, it can lead to delayed development and other complications.
So how does the condition of being anorexic and slow weight gain affect children? And what is the comprehensive solution for this issue, doctor? It seems that many of the audience are asking doctors about the effects of eating disorders and slow weight gain on children, and what they need to solve these problems.
I witnessed the increase in case of eating disorders and malnutrition in recent years is a serious health concern that can affect anyone, regardless of age or gender. However, in children, these conditions can be particularly alarming because they can have long-term effects on a child's growth, development, and overall health. This can lead to malnutrition and potential long-term illnesses. Loss of appetite and aversion of food are common symptoms of many illnesses, such as cancer, infection, and digestive disorders. It can also be caused by psychological factors such as stress, anxiety, and depression. When left untreated, loss of appetite can lead to malnutrition, a condition that occurs when the body does not receive enough nutrition to function normally. Especially during the teething period, when a child is sick or has digestive disorders, loss of appetite can make a child not want to eat or eat a lot but not absorb enough nutrients. In long-term run, if not properly addressed, it will lead to a weakened immune system, frequently illness, and slower intellectual development, especially from 0 to 12 years old in the golden period of the child's development. The important thing for parents and caregivers to recognize the signs and symptoms of these conditions and seek special nutrition care if they suspect their child may be affected. With early intervention and appropriate treatment, children can recover from anorexia and malnutrition and continue to lead healthy, fulfilling life.
So, doctor, can parents find a definitive solution to deal with the problem of children who have a poor appetite and failure to thrive?
Well, there are many different approaches depending on their underlying cause. However, today I'm here to talk about a new solution that we have widely and successfully used in the US and many other countries. That is Tao Nhi colostrum milk produced from cow's milk within 72 hours after giving birth. Colostrum milk is the first milk that cows provided after giving birth, and it contains 43 nutrients and essential growth factors for the growth and development of children. It can also bring many health benefits, including improving immune function, gut health, and healthy growth. The protein in colostrum milk and antibodies can help damage and rebuild the digestive system to easily absorb nutrients into body.
Is big digestion the cause of children eating a lot, but not being able to absorb nutrition and still being at risk of bone loss and malnutrition, right, doctor?
Yes, that's right. It's true that many parents struggle with getting their children to eat, especially when they refuse to eat too little, or snack too much. Parents should not force their children to eat, but instead practice a regular eating schedule for them. They should also avoid scolding or shooting at their children during meals, as this can make them even more scared about eating. It's important for parents to determine if their children's lack of appetite is due to psychological reasons or an illness condition. The most important issue is to heal the digestive system and improve nutrients absorption for the children, which is why many healthcare organizations and experts recommend using colostrum products as a comprehensive solution for the problem malnutrition in children who are anorexia.
That sounds promising. Can you please explain more about the effects of Tao Nhi on children who have a poor appetite or slow weight gain? Dr. Linda.
Definitely, Tao Nhi Colostrum is natural supplement, completely safe, that helps improve nutrient absorption and support healthy child development. It contains high level of 43 essential nutrients, including 2 FLHMO, 40,000 milligrams of colostrum, lysine, vitamin B1, soluble fiber, GOS, and a combination of herbal ingredients imported from Japan. I highly rate the Tao Nhi colostrum because it has the highest colostrum content on the current market, combined with safe herbal ingredients. It can help stimulate the development of the digestive system, bones, teeth, and other tissues. It also contains immune-boosting factors that can help reduce inflammation and improve food digestion absorption. Children suffering from constipation or diarrhea will also see quick improvements in just 2 weeks of using Tao Nhi colostrum. Using it for 3 to 5 days help children feel hungry and enjoy their meals. After 1 month, children can gain 1 to 2 kilograms without becoming overweight or obese. Tao Nhi colostrum has been clinically tested in the United States and is a nutrition science topic recommended by over 100 nutritionists and pediatricians. Tao Nhi is produced in a GMP standard factory and is ISO 22005 certified. Currently, Tao Nhi colostrum is sold in 9 countries: the United States, Japan, South Korea, Malaysia, Taiwan, Vietnam, the Philippines, Thailand, Myanmar, and Singapore.
Doctor, so how old can children use Tao Nhi? How long can Tao Nhi be used for? And can it be used for children with G6PD deficiency or cow's milk allergy?
Tao Nhi is used for children from 0 to 12 years old. Children with G6PD deficiency or cow's milk allergy can safely use it without side effects. Tao Nhi colostrum comes in 2 forms, canned and packaged in paper box. Parents can use canned milk as a substitute for a meal for their children during the day. For infants aged 0 to 6 months, add about 1 scoop of powder to 20-30 milliliters of warm water. Use 2 times a day for toddlers aged 6 months to 3 years old, and about 2 scoops of powder to 40-50 milliliters of warm water. Use 2 times a day. For children aged 6 to 12 years, use 3 times a day with 3 scoops of powder each time, or it can be mixed with formula milk. It is best to use it as a substitute for breakfast and before bedtime. Packaged milk in paper boxes is convenient for traveling or for children to bring to school. For infants aged 0 to 6 months and children aged 6 months to 3 years, use 1 or 2 sachets per day. For children aged 3 to 6 years, use 3 sachets per day. For children aged 6 to 12 years, use 4 sachets per day. Each sachet should be mixed with 40 milliliters of warm water, which can be mixed directly with foods or mixed with formula milk.
That's great to hear. So how can parents obtain Tao Nhi Colostrum, doctor?
Parents can register to buy Tao Nhi directly on the product's official website. I advise parents to register to receive direct advice from Tao Nhi experts to choose the most appropriate dosage for their children. We have seen about 93% excellent results from our parents' feedback after using the product, and we are delighted to provide this new option to families struggling with children's lack or appetite or failure to thrive.
And thank you to our viewers for tuning in. If your child is struggling with feeding difficulties or slow weight gain, consider discussing Tao Nhi Colostrum with our nutritionist. It could be the solution you are looking for.